what is diabetic neuropathy and how does it specifically affect the nerves in individuals with diabetes?
So, with increasing sugar in any diabetic patient, we know that every organ in the body is affected. It is not just heart, kidney, nerves, or it's not limited to any one particular vital organ. Now, we know that diabetes increases one's heart attack risk by more than 20 times or so. And then there is nephropathy. That's kidneys getting affected as well. Likewise, the nerves, basically, especially the long nerves, as in the nerves in the extremities, as in legs mainly, but also in the hands. In fact, the distribution of neuropathy in a diabetic patient is called glove and stocking distribution. As in, you get that tingling, numbness, burning sensation, all that specifically limited to first in the stocking area, the socks that you wear, and then next it will be your hands. So it's like glove and stocking distribution. And so what really happens here is the myelin sheath that covers the nerves that starts getting affected, the nerve body itself starts getting affected because of increased advanced glycosylation end products. It's called AGE, age. So these are, they start accumulating over periods of time, be it years. So usually uncontrolled diabetes within 1 year or so, undiagnosed and untreated diabetes, within a few years can can show the symptoms of diabetic neuropathy in patients. But even those who have controlled, reasonably well controlled diabetic patients also, say over 6 years, 8 years or so, they may develop a spectrum, the milder end of the spectrum of diabetic neuropathy. So the ultimate crux is that, we have seen people who come with neuropathy symptoms, which is mainly three things. You have positive symptoms, negative symptoms. Positive meaning people who have burning sensation, pins and needles kind of sensation. Negative symptoms are numbness, basically, not much sensation, either to heat, to pain, all this. So you have positive and negative kind of symptoms in these patients. And we have seen many times that the patients come with neuropathy symptoms. They don't even know that they are diabetic. You tend to investigate if they are diabetic or not, and then you find out that they happen to be diabetic, probably for years, 2 years or so. So it so happens that they don't know that they are diabetic patients. So neuropathy is something which happens when there is uncontrolled sugars over a period of time, and then the myelin sheath, the sheath that surrounds the nerves, starts getting affected, and then patients complain these symptoms. And 20%, 30% of which can be controlled or cured, but then the vast majority, 70% of severe diabetic neuropathy, there's no cure for it.
Okay. So as you spoke about the numbness and tingling sensation, what are, including these, what are the common symptoms of diabetic neuropathy, and how can people identify and differentiate them from normal discomfort?
Right. So now the symptoms, the positive and negative symptoms that we discussed, they can be present in non-diabetic patient also. Say someone who you investigate and then you find out that their HbA1c is normal, they are not diabetic at all. But then there can be neuropathy from various causes. Okay, drugs can cause neuropathy. There can be compression neuropathy, as in there can be a disc compression at the spinal level, and then people can have neuropathy, symptoms as well. So we need to differentiate that first. What is the etiology? What is the cause that's causing this? And then once you know, okay, this is diabetic neuropathy, then usually it fits into these 4 or 5 kinds of symptoms and signs, where symptoms, especially the burning kind of sensation, pins and needles sensation. Now these symptoms also can range from mild, as in some people may think it is normal. There may be some numbing in the legs, and they might not give much attention to it. Although, especially if you're in the bracket of that, if there is a possibility for you to be a diabetic, or if you have family history, then any kind of numbness, be it in the toe, in the sole, entire sole, or is it very numb, as in you might not even have sensation to heat or cold and all that. So if that is the situation, you need immediate help, as in you need to be diagnosed. you need to be tested first, and then science and all, we do a monofilament testing in our clinic, OP visit, but then there are some gold standard tests like nerve conduction study. So nerve conduction study tells us specifically the degree of neuropathy, the type of neuropathy as well. There is axonal neuropathy, there is sensory neuropathy, motor neuropathy, and all these. So predominantly diabetic neuropathy presents with sensory neuropathy, where, like we discussed, all these numbness is also one symptom, although it is a negative symptom. It's not pointing to one particular thing, but then there is positive symptoms like tingling, numbness, and burning sensation. Now the degree of this can be severe in an uncontrolled diabetic with, say, HbA1c of 11, 12, 13 or so. Their neuropathy symptoms are so bad that whatever medicine that you give, patient is not going to be relieved of the pain. And there are not so many medicines. You only have 3-4 classes of medicines, and then you'll have to keep increasing the dose, and then you will have side effects from those medicines as well, drowsiness, sleepiness, and all. And then some of the medicines can interact with the electrical activity of the heart and cause some arrhythmias as well. So going back to the root problem. So when you have diabetes and you have this numbness or tingling or pins and needles sensation or burning sensation, please get yourself evaluated. And the crux, the pillar of treatment of diabetic neuropathy is controlling sugars first, blood sugars. You cannot allow your fasting to be beyond 120. Your post-lunch, after food, sugar cannot be beyond 170. And then your HbA1c should not be more than 7. So these are some cutoff points which will help you guide as to, some degree of neuropathy can be reversed or stopped. As in, if your neuropathy is so bad, when your sugars are say 12, when your HbA1c is 12, 13, when you bring your HbA1c to 7, your neuropathy will improve by 50%. But then it's not going to improve by 100% because the damage that is already done, you can't undo it. You can only prevent further damage to be done by controlling your sugars and all. But then some degree of myelination, the myelin sheath damage and the nerve damage that occurs, the body tends to repair. But then you will never get the complete 100% repair possible.
Okay. So since you said that 100% cure is not possible, so in light of that, what are some practical strategies for managing and relieving neuropathic pain? I guess pain is also pain also happens. So neuropathic pain on a day-to-day basis.
Yeah, like I just said, the crux of diabetic neuropathy, or in fact diabetic retinopathy or nephropathy, or even to prevent heart disease in any diabetic patient, the crux, the pillar is sugar control. Good sugar control, as in fasting 80 to 120. After food 130 to 170, HbA1c 7. So these if you maintain this for in fact these goals are forever. These are to be you need to try and achieve these goals as much possible for however long it takes. So that is one way of limiting diabetic neuropathy from worsening. And but then when you already have neuropathy, you can only probably bring down relief to some extent. Now, apart from sugar control, you need to have good blood pressure control as well, because when you multiply the risk of poor blood supply to your feet, when there is already neuropathy, then you are at a very high risk of developing diabetic foot or diabetic ulcers. These ulcers form only because of first, because of this numbness that the diabetic neuropathy causes. Second, because of decreased poor blood supply to the sole or to the toe, greater toe, and all this. So when you have good blood supply, as an improved blood supply by giving a blood thinner if required, a cholesterol lowering medicine will improve blood supply by limiting the blockade. Peripheral vascular disease is something very common in a diabetic patient, where blood supply to legs is minimized because of cholesterol deposition. So you need to make sure diabetic patients, apart from having good sugar control, they need to have good BP control, cholesterol lowering medicine, blood thinner if required, and making sure there is good podiatric care, as in they need to keep inspecting their feet and look for ulcers, because sometimes there may be an ulcer, but they don't even know that because it has become numb. And then only upon when we remove the socks and the shoe and then when there is an examination done, you will understand that, okay, there is an ulcer. And any other non-diabetic patient would be writhing in pain. But diabetic patients don't have that pain, so they tend to not even notice it. So that is where diabetic ulcers start becoming diabetic foot, diabetic cellulitis, and then sepsis, and sometimes gangrene. Wet and dry gangrenes also they result, and then a serious wet gangrene, as we all know, needs amputation. Now, going back to neuropathy medicines, apart from sugar and BP control, cholesterol lowering medicine and all, there are not so many medicines. There are probably 3 or 4 classes of medicines that we can give to bring down the debilitating pain symptoms of a diabetic patient, neuropathy patient. We have amitriptyline, you have gabapentin, you have pregabalin, duloxetine. So these are 4 important medicines that we can give. And then, of course, the dosage ranges from how severe the neuropathy is. Gabapentin can be given up to 400 mg. In fact, probably even up to 800 mg. But usually patients don't tolerate beyond 400 mg. You can escalate slowly from 100 mg gabapentin to 100, 200, and then 400. Then you have nortriptyline that you can add. Again, before adding nortriptyline, one needs to look at the ECG, because it is a tricyclic antidepressant, and there can be some ECG problems when you are giving nortriptyline. Likewise, pregabalin, 50 mg, then 75 mg as and when patients require, then duloxetine, 30 mg. So these are medicines that can bring down the severity of peripheral neuropathy of diabetes to a certain extent, probably sometimes by 70% or so. But then it will never be 100%, because there is a damage that is already there, and you can't reverse the damage. On one side, you're trying to minimize the myelin sheath damage and all by having good sugar control. On the other side, you're trying to bring down the firing of each nerve root, the branches of each nerve that is actually causing so much burning sensation and all. So on you have pain medicines on one side, then good sugar control, good blood supply, then BP, cholesterol lowering medicines, all these on the other side. So it's always a holistic care, and one should always understand and realize that a diabetic neuropathy patient is at a very high risk of developing diabetic ulcers, diabetic foot ulcers, diabetic cellulitis, and all those. So every visit that the patient comes, I make it a point that I inspect their feet, and there should not be any ulcers. If there is nails growing, they need to clip it, and then we look at monofilament testing, as we need to check how the sensations are intact or not, all those things. If you have a doubt, you will have to confirm it with nerve conduction study test, the NCS that we do. That will give us an idea as to how bad the sensory neuropathy is, if it is mild, moderate, or severe. And then sometimes even a scalding hot water and all, patients tend to not even understand that the warmth of it. So that is just one example. So I think it is up to the family and the treating physician to identify the severity of neuropathy and then address it accordingly.
Right. So you mentioned about some medicines. Do these medicine contraindicate with diabetes medicine, because that is going to continue side by side, right? Parallelly.
Yes.
So
not essentially, like I said, apart from a few tricyclic antidepressants like amitriptyline or nortriptyline, gabapentin and pregabalin are pretty safe. Can be given long term, even decades actually, without much side effects. Only thing, there is some degree of drowsiness, so that is why we give it in the night. So but then if patient has next day morning or afternoon, if patient feels still drowsy, we tend to bring down the dose by half. But as such, they don't interact with the anti-diabetic agents that they're on, and they are reasonably safe. But then one class needs ECG monitoring at least once a month, and then we have to see that there is no dangerous changes occurring in the ECG because of these medicines.
Okay. So, so for audience, it's very important that although we are discussing medicines, but you have to make sure that you consult with your doctor before taking any medicine. यहाँ से टेक अवे ये नहीं होना चाहिए कि हमने दुकान जाके दवाई खरीद के खा लिया कि हमको दिक्कत हो रही है. Go and talk to the doctor, and they will prescribe you the required medicine. So, before moving on, I would like to tell you and our audience about our diabetes community on WhatsApp. So audience, if you're serious about diabetes management and eager to connect with like-minded people, join our supportive community of individuals like you. simply drop a message in the chat saying I'm in, and we'll make sure that you get an invitation. Or else you can find the link in our bio. So moving on, how can individuals with diabetic neuropathy incorporate safe and effective physical activities into their daily routine to maintain mobility?
Yeah, I think exercise is something diabetic neuropathy will not hamper too much. I mean, of course, we recommend say either treadmill or brisk walk and all for a diabetic patient. But diabetic neuropathy per se will not really obstruct the exercise routine. But I think, but then if they are going to walk outside, brisk walk and all, there is a possibility for micro trauma and for them to not realize the degree of trauma, as in wounds, small wounds and all.
Right.
Which is why we tell them to wear shoes, socks and shoes and or sandals and all. But socks are a must. And then there are special diabetic socks and all that some companies provide, where there is good cushion and they tend to protect the the skin lining and all. So I think diabetic neuropathy is exercise wise it doesn't come too much in the way, but the brisk walk and say if patients are younger, say 50 or less, we even tell them to do weights as well, resistance training today, then cardio tomorrow. They can always alternate. So exercise again is really important for a diabetic patient because, like I said, there are three pillars of diabetic management: diet and exercise form the two pillars, while drugs, anti-diabetic agents form the third pillar. All three pillars are really important, as in 33% each. And so exercise is really important. With good exercise, patients are going to improve their insulin sensitivity. With the increased muscle mass, their diabetes risk can actually come down. And with building of muscle mass, be it in thighs, calf, or biceps or triceps, or various muscle groups in the body, if the muscle mass increases, the total body fat comes down. And probably there are times where good workout, good patients who are doing good workout and all, they tend to have a better insulin sensitivity. And if they were on insulin, there are times where they could actually stop insulin. So it is possible that exercise can actually bring down the dosage of anti-diabetic medicines and even the number of anti-diabetic medicines. And I think neuropathy per se will not be a deterrent.
I guess, as you said, that if you can control the diabetes, then blood sugar levels, then it can help with neuropathy. So
Yeah.
exercise that way can help also. So
Right.
yeah, are there any specific sleep positions or adjustments that individuals with diabetic neuropathy should consider for a more comfortable and restful night's sleep?
Not really. I think unless it is debilitating, unless the pain is so bad that if it is so bad, whichever position they sleep in, the position actually doesn't have much bearing on the pain. So, but then I think we have to make sure that patients who have insomnia because of this pain, they tend to have blood sugars going up. So because body goes into a increased stress mode, where cortisol hormones and other stressor hormones are injected into your body through your various adrenal glands and other endocrine organs. So when there is chronic insomnia, blood sugar levels go up. So we need to make sure that luckily the medicines you are giving for neuropathy will help a diabetic patient sleep well. But as such, position may not have much bearing here.
So what practical tips can you provide for managing, apart from medicines and all obviously, practical tips for managing numbness and tingling sensations due to diabetic neuropathy in day-to-day situations?
Yeah, so apart from medicines, I think first and foremost would be trying to massage. If you can get a warm, basically to prevent diabetic foot or diabetic micro ulcers and all, foot care is really important. And like I said, since there is so much numbness, it is a negative symptom where patients can't perceive, many painful either trauma or when they walk and all. So I think every alternate day, each diabetic patient should give a 10-minute routine himself or herself, where they can rinse their feet in a bucket of warm water, just and then put some shampoo or some lather it up, and then make sure they soak it for about 5 to 7 8 minutes. Then remove it, and then they need to do some fuming. They need to make sure the dead tissue is all removed. So and then apply either olive oil or coconut oil or any moisturizer and all. Because we see that these cracks that they develop in the sole, those become nidus for crores of bacteria to sit there and multiply. And in fact, that is how the diabetic foot and ulcers and all develop. So I think this foot care is pretty simple. They can do it. Everybody can do it, and make sure there are no cracks or there's no kind of a micro trauma or that's going on. And if there is some degree of massage, you are actually encouraging good blood supply to the feet, because feet have very less blood supply compared to any other organ in the body. So a good gentle warm massage or using a massager, there are handheld massagers that are available. So if you do that, I think blood supply improves, and that is something that even to some extent neuropathy also may improve.
Okay. So that was all from my side.